All right, we will get started. Hello, I'm Dr. Wood. I'm a naturopathic physician with Tummy Temple, and thyroid conditions are um, an area that both Dr. Dowdy and myself work with all the time and feel passionate about helping people to um, feel better and figure out. So we both see patients for a whole bunch of other conditions as well, but this is a big one. And we love the co-op and are so grateful that you have this classes program and are hosting us. So thank you for that and for all the wonderful food you provide. Um, Dr. Dowdy, do you want to introduce yourself and get
Hello.
started?
I'm a naturopathic physician in practice for 16 years, and I'm the medical director of Tummy Temple Clinics, one in Lacey and our mothership in Seattle. So happy to be here. We're going to talk about hidden causes of thyroid disorders today, because it's actually a very common condition, especially hypothyroidism. And hypothyroidism means low thyroid function, and it's estimated to affect up to 20 million Americans. And about 60% of people affected aren't aware that they have a thyroid problem. Interestingly, 95% of patients affected with thyroid disease have something called Hashimoto's thyroiditis. This is an autoimmune condition where a person's immune system is actually causing some destruction and is attacking their own thyroid gland. So that is 95% of the thyroid disorders. Unfortunately, thyroid disease disproportionately affects women. 1 in 8 women will develop a thyroid disorder in her lifetime. And interestingly, we see thyroid disorders become apparent when there's other shifts in hormone systems. What I mean by that is pregnancy, for example, a big shift in a woman's endocrine system, hormone system can be a time where the thyroid can become dysfunctional. Menopause or perimenopause, even postpartum. So anytime there's a swing hormonally, that can be another trigger. So, yeah, we're going to get into all of that today.
So the thyroid gland, its role is to produce hormones called really primarily two different hormones. One of them is called thyroxine, or also known as T4. The other one is called triiodothyronine, or T3, much easier to say. And so it releases hormones into the bloodstream. It's a little butterfly-shaped gland that sits kind of over the windpipe in the neck, in the front of the neck, the base of the throat. And those hormones travel all through the bloodstream, all throughout the body, and then are taken up by every single cell in our body. Every cell in our body needs thyroid hormone to function normally. And those hormones act to increase our metabolic rate, and they really just affect pretty much everything. So, the thyroid hormone, to name a few, plays a direct role in the health and normal functioning of the brain, of the gut, the heart, the bones, blood, liver, gallbladder, hormone production of other types of hormones, blood sugar balance, cholesterol levels, protein metabolism when we're digesting protein, and our body temperature. So, it has very far-reaching effects.
So then I think it'd be helpful to review what some of the symptoms a person might experience if they have a thyroid disorder. And again, as Dr. Wood mentioned, because that hormone is used in every single body system and every single cell, the symptoms can be very broad and overlapping. So, because the thyroid gland and those hormones are the thermostat of the body, they will definitely affect temperature. And for example, if someone is in a hyperthyroid state, meaning they have too much thyroid hormone circulating, they can struggle with feeling overheated all the time and excessive sweating. It often will cause anxiety and insomnia, a kind of agitation, weight loss. that the hormone, because it affects metabolism, is catabolic, meaning it breaks down, it speeds up. So a lot of the symptoms are a result of that. Weight loss is common, diarrhea or looser stools with too much thyroid hormone, a faster heart rate, palpitations, tachycardia, which is a racing heart rate. And then when those symptoms and that hyper state go on unchecked for a period of time, it can lead to bone matrix breakdown, excuse me, and increase the risk for osteoporosis long term. And again, just because everything is rapidly turning over at too fast of a pace. Then on the opposite end, we've got hypo or low functioning, too little thyroid, and those symptoms are the opposite. Patients often complain they're tired, more fatigued than they feel like they should be. They're often cold intolerant. It's hard to keep their body temperature maintained. Digestion slows down. Constipation is common, just kind of sluggish transit time, maybe feeling full, slower digestion, more bloated, a propensity to easier weight gain, hair loss and drier skin and those type of tissues, achier joints, achier muscles, again, kind of a fatigue picture with hypothyroid. And it actually can affect the brain and cognitive processing. So slower executive thinking and brain fog is a really common complaint in people with hypothyroid. Oh, Dr. Wood, you're unmuted. You have to rewind.
Sorry about that. We're going to go a little bit more in depth into the types of thyroid conditions. So, as Dr. Dowdy mentioned earlier, Hashimoto's thyroiditis is absolutely the most common. And in some ways, this could be considered a disease of the immune system that is affecting the thyroid because the immune system is revved up and attacking the thyroid. So the thyroid is sort of the target, but in some ways it's the immune system that's the source of the issue. This is the most common condition in the United States affecting the thyroid. The immune system is making antibodies that tag thyroid cells in the thyroid for destruction. And then there are usually other problems going on at the same time that are contributing to the symptoms and are somewhat caused by the condition, including nutrient deficiencies, hormone imbalances, low stomach acid, imbalances in the bacteria in the gut, which is called dysbiosis in the medical world. And all of those factors play into this vicious cycle of Hashimoto's thyroiditis, which means Hashimoto's thyroid inflammation. Early on in the course of the disease, people can sometimes swing back and forth between symptoms of too much thyroid, symptoms of too little thyroid, because as the cells of the thyroid are being attacked, sometimes some of them are basically bursting open and releasing the thyroid hormone that's inside them. And so then you're getting little bursts of too much thyroid hormone. But then in the long run, as more and more cells are destroyed, then there's just going to be like a trajectory toward low thyroid symptoms. Conventionally, in the conventional medical world, this condition is treated by replacing the lost thyroid hormone, usually for the rest of your life. And so, yeah, you just you take some thyroid hormone because the body is making less of it at that point. From our perspective in the naturopathic world, we would do that. We would replace the lost thyroid hormone because you absolutely need it to function. And we would work to identify reasons why the immune system is behaving as it is, seek to remove or shift those root causes, work on improving digestion and absorption of nutrients, correct nutrient deficiencies, help you with your stress response and hormone balance in general and more, depending on the person, because of course we're each unique and have, sometimes a different constellation of factors playing into this issue. So using this approach, a lot of times we can halt further destruction of the thyroid gland. Sometimes some of the lost thyroid function can be regained using this approach. Not always. I never look at it as like the entire goal is to get you off of thyroid replacement therapy. That's not really the point. Sometimes people need that, and it is literally just extra thyroid hormone because the body isn't making enough, and that is a really valuable thing. And so, but we want everything to be working better. And if in the course of helping everything work better, you need less thyroid hormone, or, occasionally someone will not need it anymore at all, that's wonderful. So, all right. And Dr. Dowdy's going to talk about another less common thyroid disease, but we still want to touch on it.
Yeah, so swinging back to the other side, hyperthyroid or Graves' disease, less common, but also a disorder of an immune system that is manifesting as thyroid disease. So in the hyper state, remember someone's in a catabolic, breaking down too much hormone circulating. And that happens because the immune system is making antibodies that stimulate that gland in the neck and the throat to make more hormone. So instead of tagging it for destruction, it's stimulant to make more than the body actually needs. This condition is more harmful and can be trickier to treat since those excessive hormones can cause a lot of stress in systems like the heart and maintaining weight and metabolism. Typically, it is treated with suppressive medications to slow down the thyroid gland's release of those hormones. And then sometimes the gland even needs to be removed or uh, 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 destroyed medically through treatments. And then if that's the case, a person is going to need controlled thyroid replacement medication for the rest of their life, really, because just enough is great, too much not good, not enough also not good. So, and then there's this last category of hypothyroidism, which is not related to an autoimmune disease. And we're going to go into what are the main causes of this condition because it is also very common. And there are a lot of nutritional, environmental, lifestyle, hormonal balancing things that can help with non-autoimmune hypothyroidism. So, yeah.
I'm going to go a little bit into testing. Um, because a lot of times, like if you go to see your MD or your kind of conventional medicine provider, most commonly they are going to run a test called TSH, or thyroid stimulating hormone. And then maybe they will also test free T4, so the free circulating levels of T4 thyroid hormone. And sometimes that is sufficient to figure out what's going on with someone's thyroid, but not always. And so a lot of people get missed, or they're taking their thyroid hormone replacement, but they still feel terrible. And from the perspective of the TSH, it looks like everything's great, but they don't feel great. And so sometimes doing a deeper dive on testing can be really, really useful and help reveal why the person still doesn't feel good, or, why something might need to shift in their treatment plan. So TSH is actually a signal coming from the brain, going to the thyroid, letting the thyroid know whether or not there is enough circulating thyroid hormone being produced and put out into the bloodstream by the thyroid. So it's a feedback mechanism. So when your thyroid is making lots of thyroid hormone, maybe even a little too much, the TSH will go down really, really low, like vanishingly small amount. And that's basically that the TSH means make more thyroid. So if you have more TSH, it's kind of yelling at your thyroid to make more. When it goes really, really low, that's your brain basically saying like, we're good, don't make any more. And so yeah, a high TSH means um, there's not enough thyroid hormone and your body is saying like, please, we could use some more. Low TSH means there's too much thyroid hormone. And then we want it to be in a middle range. And like in that sweet spot, indicating like there's no issue or we've got your medication dose just right. And then free T4 hormone is just like the circulating amount that is not bound to anything. There's like total T4, but that's a little bit less useful. But free T4 is um, the bulk of the hormone that's released by the thyroid is in the form of T4. And so that kind of tells us like how much there actually is of the hormone. And then what can be really useful and what doesn't typically get run in the conventional world is free T3. So that is the other thyroid hormone. Our bodies don't make as much of that, but it's really important. It's actually the hormone that's the most active, that makes us feel good and makes us feel warm and have energy and helps our hair grow and all of these things. And so sometimes TSH and free T4 look great, and then you look at free T3 and it's quite low. Um, and that can sometimes explain why the person is not feeling well. There's another test called reverse T3. This is an inactive storage form of thyroid hormone. So there's kind of two main reasons why your body would like shunt a bunch of thyroid hormone into this storage form that doesn't do anything for you. One is when your body is under a ton of stress. And then the other is when your body is experiencing a lot of inflammation, which is kind of another type of stress. So in that case, T4 gets converted to reverse T3 to kind of like conserve energy. Like, let's batten down the hatches and just like, store up energy because times are tough. There's some big stress or inflammation going on. We have to conserve. So that's what reverse T3 is about. And so that can also be really useful to check because, again, maybe TSH and free T4 look great, but then you check reverse T3 and there's a ton of it. And so it's like the T4 is being converted into something that's not usable for you and definitely doesn't make you feel good. Um, and then final two kind of main tests that we run quite frequently are you can actually check for the different types of antibodies that attack the thyroid in Hashimoto's thyroiditis. So those are called anti-TPO antibodies and anti-TG antibodies. So those are that's what tells us it's the autoimmune type of low thyroid function. And then finally, there's a different antibody that you can check that tells you it's the autoimmune type of too much thyroid condition or the Graves' disease. So that's kind of all of the main ones we do. It's not an exhaustive list. There are other thyroid tests, but we don't run them as often. We find them less useful. So you can ask your doctor to run more of these. They may say yes, they may say no. But you can ask. And then, you could come see one of us and we will happily order these for you if you're struggling and not feeling well and want to dig deeper.
Mhm. Yeah, I was going to share that a lot of the time we see patients who come in, saying, gosh, I think something's still not right with my thyroid, or maybe they're on medication and they feel like their dose isn't correct. As Dr. Wood was saying, their primary doctor runs the TSH and they're within the range. Well, the ranges that we see on these lab reports are very, very broad.
That's a great
And,
point.
who wants to be an outlier in the bell curve, and feeling crummy and being told, no, you're fine. The labs say you're great. We listen to our patients, we look at the symptoms, and we don't just treat on, okay, well, you're within this broad range of labs. Like, we're going to do more investigating. We're going to potentially adjust the treatment protocol. So,
Right. Yeah,
yeah,
that's a
yeah.
great point. Yeah, the range of what's considered normal takes into account like this vast array of humans, and some of them, their thyroid's not working that great, or they're not super healthy, but they got lumped in. And so it makes for this really broad range that actually maybe doesn't reflect like really good optimal thyroid health.
For sure. Yeah.
Yeah.
And there's a whole progression in becoming potentially hypothyroid. It's not like just one day you go from feeling great to not. So we like to treat people before they're frank outside of the range grossly and really struggling. So,
Yeah.
yeah. All right. So I was just going to talk a little bit more about the autoimmune thyroid process, especially Hashimoto's, and like what is happening and what are the potential pieces of that development, that imbalance. So remember again, the immune system is what's causing the dysfunction. It's not the thyroid gland organically itself in an autoimmune disease. And there is something then that is triggering or confusing or flaring the immune system and having it produce antibodies against our own body cells, specifically the thyroid gland. And when we look at autoimmunity, we are looking at someone's potentially genetic predisposition. So we often will hear, my mom had this, my sister had this, my kids have this. So there's a genetic potential predisposition, but then there's also going to be a trigger, right? Something is going to cause potentially a gene to express. And a really common trigger comes back to the gut, actually, and intestinal permeability. So there's this like three-legged stool of autoimmune processes being genetic predisposition, triggering event, and healthy gut, healthy intestinal permeability. And the reason behind that is because the lining of our intestines is a way that we have a barrier between the outside world or food that we're eating that we need to nourish our body and the inside of our body. Basically, our immune system is designed to just discern between what is you and not you, right? And when we eat our food and we break it down into the basic components, like proteins become amino acids, carbohydrates get broken down to glucose, fats become little micelle fat droplets. Once they are broken down to that level, they're not going to be recognized as like the sandwich you just ate. Our body has very specific mechanisms in the small intestinal layer to decide how they're going to be absorbed into the bloodstream. And that's important because our immune cells are residing just under that layer in the bloodstream. And they're constantly surveilling and filtering and paying attention to what is self, you, and not you. And when that selective barrier between your digestive tract and your bloodstream is irritated or inflamed, maybe you had a bout of food poisoning, maybe you've been on some medications that can affect gut health. What happens is that barrier is not as selective anymore. And naturopathic doctors often use a term called leaky gut. And it's because this nice tight colander maybe has some gaps between the cells now. And larger proteins and antigens can filter through. So it's our body reacting to the leaky gut situation as if there was an infection, right? And it's going to have the same type of response as long as the leaky gut continues. And this is a very common trigger for autoimmune processes. So starting with that irritation and inflammation in the gut.
So getting a little deeper into root causes, and actually a lot of these things that we're going to talk about cause or worsen um, inflammation, and they do that at least in part by irritating and inflaming the lining of the gut. So, there's sort of this interplay between like leaky gut causing inflammation and these various inflammatory things causing leaky gut. So inflammation from all these different things, which we will talk about a bunch more of them, promotes that conversion of the T4 hormone to reverse T3 instead of the normal T3, which is the normal T3 is what makes us feel good. And then also inflammation promotes increased immune activity that then causes collateral damage to the thyroid. Um, Another major factor, root cause, is stress and adrenal dysfunction. So that again, promotes conversion of T4 to reverse T3 instead of normal T3. The adrenal glands are two small kind of triangular glands that sit like little caps atop our kidneys. The kidneys are like in the back of the body, kind of protected by the back of your rib cage. And those adrenal glands make up another crucial aspect of our hormone regulation system in the body. They work in close concert with the thyroid gland to allow us to have energy and respond to stress. They're basically our stress response system. So if the thyroid is our metabolism or like our thermostat, the adrenals are the stress response system. They produce adrenaline in acutely stressful situations that give you that like shock of energy that makes your heart race. And then they also produce a more slow burning stress hormone called cortisol, which gets like we need some cortisol. It's actually a really useful thing for us. It should spike every morning. It helps wake us up in the morning. It actually helps kill autoimmune and cancer cells when we get that morning spike. Um, but when we're under constant chronic stress over long periods of time, the adrenals can start to get a little wonky. Sometimes people will have spikes of cortisol at random times throughout the day, or maybe even at bedtime. Um, uh, or, prolonged chronic stress, the body can kind of just like turn down the cortisol drip. And people can just have like barely any produced all day, no morning spike, but like hardly any ever, and just feel like really sluggish and draggy all the time. Um, so, um, you can think of the adrenal glands as kind of providing this like stable foundation of hormonal activity for the thyroid to stand on. So if the adrenals are wacky, even if the thyroid is not like having an autoimmune problem itself or not like, like nothing terrible is happening with the thyroid, it just won't work as well if the adrenals are really out of whack. Um, I've frequently seen my patients who have hypothyroidism or low thyroid function actually be able to decrease the amount of thyroid hormone that they need to take when we help their adrenal system work better. Um, and then additionally, when you're under a lot of stress and have high levels of cortisol present, your body takes that as a sign to conserve resources to deal with whatever that stressful thing is. And so, in service to that, the T3 hormone gets converted to reverse T3. So, we've been touching on that a lot, but this is one of the ways that that happens in a bit more detail. And it makes a lot of sense. Like, there's a reason the body is doing this. It's really trying to conserve resources and protect you, but then, you don't feel well with that.
Okay, we're going to move on to another potential cause, hidden infections. So, in some cases, a trigger for the immune system attacking the thyroid gland is not because it is confused, but because there's some type of stealth or chronic infection in someone's body that kind of just stirs up the immune system. Sometimes they even hide in the thyroid gland, and that can lead to a subsequent injury from that whole process. The immune system is typically trying to work to clear or eradicate the infection, but sometimes collateral damage ends up happening to the thyroid gland and someone ends up in a hypo or low functioning state. A virus that is known to affect the thyroid gland and play a role in many cases of Hashimoto's thyroiditis is Epstein-Barr virus, or EBV. This is the virus that causes the clinical condition called mononucleosis, or mono. Once someone has experienced and contracted mono, it can hang out, it will hang out in their body forever. But typically, in a healthy person who has a balanced and strong immune system, the virus stays in dormancy and never causes any trouble. But if the immune system is strained, the virus can come out of dormancy or come out of hiding and cause dysfunction and distraction on the immune system, and again, collateral damage to the thyroid gland, because that is the most common organ that is affected with reactivated Epstein-Barr virus. There's also some other fungal conditions, candida, small intestinal bacteria overgrowth, a gut imbalance can also lead to a hidden infection of thyroid dysfunction, and all types of parasites can do that as well.
And then a whole other category is environmental toxicity. So there are actually kind of a lot of types of environmental toxicants that really mess with the thyroid. Couple top ones are halogens. And so that's like on the periodic table. The column that iodine is in. There are a bunch of other elements in that column that can kind of bump like we need iodine for the thyroid to work normally. If we get exposed to a bunch of these other similar enough compounds, they can like bump iodine out of there and really throw things off. And then heavy metals are another big category. So since iodine is so crucial for proper thyroid function, anything that interferes with the thyroid getting access to enough iodine is going to cause problems. Um, there are unfortunately a lot of environmental sources of halogens. The other elements in that list are chlorine, bromine, and fluoride. Chlorine and fluoride are often found in drinking water unless you use uh, really good quality water filter. Chlorine is easier to filter out than fluoride. Um, but yeah, so it's quite frequent to be exposed to those. Um, Not every community adds fluoride to the water, but a lot of places do. Um, and then bromine is found in many processed breads because flours are brominated in order to bleach them and to increase the elasticity of the dough. So any of these chemicals can and do displace thyroid iodine in the thyroid, leading to lower thyroid function. And then heavy metals can really interfere with thyroid function as well, as can some other chemicals like formaldehyde. Some of the chemicals found in breast implants actually can throw off thyroid function, and then mold found in the environment can really interfere with thyroid function as well. And the list doesn't end there, but we can't go into um, every single thing, and those are some of the worst offenders and the most common things.
There's also nutritional deficiencies or nutrient deficiencies that can be a cause of dysfunctional thyroid hormone or lack of thyroid hormone production specifically. Iodine, the most common, and tyrosine. Those are the two building blocks of making thyroid hormone, T4 or T3. Tyrosine is found in a lot of protein foods, tofu, beef, chicken, eggs, cheese, nuts. There's a whole list. Selenium. Selenium is really important for thyroid function. It helps with the conversion of that circulating T4 to becoming active T3, the what your body uses and makes you feel good. Zinc and copper are also really important. B vitamins, potassium. Did I say iron? If I missed iron, there's
Oh,
lots of research correlating low iron
Here.
stores, which is measured by testing ferritin in your blood. Low ferritin is often associated with lower thyroid function, lower thyroid hormone. So correcting an iron deficiency, which can be really common in menstruating women, can improve thyroid function. And then there's also the fat soluble vitamin A and vitamin E that are important.
mhm.
And a lot of the time, these deficiencies can happen because a lot of these are trace minerals, and our food supply isn't what it used to be. And farming practices have led to just lower mineral content in foods grown in the soil overall. Another cause is just the processing of foods. The reason to choose more whole foods. When we're processing and refining foods, we're going to be removing minerals. We're often sometimes replacing minerals, like Dr. Wood just said, iodine being replaced in some of the bread products. Um, uh, Eating more processed or simple carbohydrate foods are often a cause of nutrient deficiency because those are lower nutritious foods. And then there's also an absorption piece to consider. So someone has a lot of inflammation in their digestive tract or a lot of imbalance in their microbiome. So the good bacteria in our colon, if there's a state of imbalance or dysbiosis, that can affect how well our body is absorbing certain minerals. There's also stomach acid and its role in mineral absorption, amino acid breakdown and absorption. And sometimes people have low stomach acid from being chronically stressed, or maybe they have been taking acid blocking medication for reflux for a while, and that will lead to chronic mineral deficiencies over time. Using antibiotics, again, because it will affect your microbiome, your colon flora can lead to an imbalance. That's another cause of developing a deficiency of certain nutrients. Um, Unfortunately, in a state of autoimmune Hashimoto's thyroiditis, the gut is more compromised and it's harder to absorb and extract nutrients from your food. Leaky gut, as we mentioned earlier, and celiac disease, actually. Celiac disease is a genetic disease where a person is intolerant to a gluten and gliadin proteins. And there is a strong association that patients with Hashimoto's thyroiditis are 5 times more likely to be diagnosed with celiac disease. Um,
And I
oh,
just want to interrupt for a
yeah.
moment. Something that has kind of become more clear with research over the past 10 years or so is that while iodine is super duper important for the thyroid, and we absolutely need it for the thyroid to work normally, we can have too much iodine, and that also can cause thyroid problems. And it's kind of shifted because of shifts in the food system and the way that foods are produced from, like 50 years ago. Actually, in most of the world, the main cause of low thyroid function was low iodine. But that has actually shifted like pretty much everywhere in the whole world to now one of the main factors is too much iodine. And so we do need to be paying attention to, there are cases where people aren't getting enough, but what's more common is to be getting too much. And iodine, we need it, but we just need this little tiny amount each day. And too much is inflammatory. It actually causes increased inflammation in the thyroid to get too much. Some of the sources where we frequently are getting iodine is, of course, iodized salt, and that was introduced to deal with the like worldwide problem in the past of iodine deficiency. Um, and if it were that alone, we'd probably be doing okay. But then, depending on diet, fish can have a lot, seaweed can have an absolute ton. Um, Dairy has actually a fair amount and that's like a change in the way that foods are produced because it's used to sanitize cow udders and then it ends up in the milk. It's found in eggs, it's found in actually some bread products, and then Himalayan pink salt, which a lot of people use to try and be more healthy, has it will say on the packaging, like it'll swear up and down, not a source of iodine. It actually, on third-party testing, it has double the iodine of iodized salt. So Himalayan pink salt actually has a ton. And it's a major factor with flaring up the antibodies in Hashimoto's thyroiditis because it's causing all of this inflammation from just too much. A nice thing about selenium is it works in two ways. It helps with the conversion of T4 thyroid hormone to the more active T3, but it also is a wonderful antioxidant that helps protect the thyroid from inflammation. So just taking 200 micrograms of selenium alone can help lower thyroid antibodies in Hashimoto's substantially. So yeah, just wanted to make sure we touched on that um, some iodine good, but we reach a limit at pretty quickly.
Mm-hmm. Yeah. The last thing I was going to mention about gluten intolerance is that so there's this association with Hashimoto's patients having 5 times the occurrence of celiac disease. But we know that even if a patient does not have celiac disease, there still is a trigger for the immune system from the gluten. And it's this mimicking process where when someone is consuming gluten, the immune system is confused just from that and will be more active and target the thyroid gland and those cells for destruction. So there's, even if you had a negative celiac disease, or celiac marker test, it could still behoove a patient to be avoiding gluten, and their Hashimoto's would get better control with that. So, and the last piece with nutrient deficiencies to consider is that T4 to T3, so from the active form, that conversion, a lot of it happens in the liver. So, the state of someone's liver and the health of your liver is important for that conversion reaction to happen. So, lots of different points of consideration with
Yeah.
optimizing this gland.
Yeah, it really can help to work with someone to kind of tease it apart because
Yes.
this is a lot of information. And sometimes it takes some digging in. That's another thing where I have had people do some, concentrated work on improving their liver function and also seen them, kind of develop excess thyroid hormone symptoms on the same dose of thyroid hormone that was perfect for them before. Now it's too much. And so we need to lower their thyroid hormone dose because their liver is working better. So,
Mhm.
um, all right, so we're gonna wrap up with self-care for the thyroid. So, eating a nutrient-dense diet, whole foods as much as possible, minimal processed foods, um, ruling out celiac disease. And then, so you need to be eating wheat and gluten for the testing to be accurate. So you want to like test first. And then if you do have celiac disease or antibodies that show a gluten sensitivity, then avoid gluten if you have a sensitivity to it. And really, it takes at least a 6-week elimination diet to like really see the full benefits of whether or not you're gonna feel significantly better off of gluten. The most important foods to consider avoiding with low thyroid function are gluten, dairy, and soy. Um, I would say excess, like eating a ton of soy-based foods can have a suppressive effect on the thyroid. Having some tofu like 2 or 3 times a week or tempeh or something like that, no big deal. I would not worry about that. Um, and then, maybe like drinking soy milk every day maybe could be too much, but having some is not a problem. Same with cruciferous vegetables. So a lot of people have heard that like broccoli, cauliflower, um, kale, foods in that family can suppress the thyroid. And while that is true, you have to be eating an absolute ton. It would be really hard to eat enough of the whole foods to have that happen. The times when that really happens is juicing the raw vegetables. So like juicing a ton of kale, not a great thing to do if you have low thyroid function. But you can absolutely eat broccoli. That's not a problem. Um, and then back to self-care factors, make sure you're getting plenty of minerals. You can take a trace mineral supplement. You can also drink daily, have some tea made from mineral-rich herbs, which include nettle, red raspberry leaf, and alfalfa. And then make sure you are absorbing your minerals. So if you have acid reflux or other signs of digestive disturbances like bloating, frequent burping after meals, you may not be optimally absorbing your nutrients. And so getting help with that is really important. Managing your stress, I know that is, a massive topic, but finding ways to, whether it's meditation, whether it's walking in nature, whether it is taking a close look at where you can let things go in all the things that you take on and manage in your life and letting whatever can be let go. Speaking up about your needs. So just like on an energetic level, the thyroid is at this chakra that is all about communication. And, people can hold stress in this area when they constantly suppress their needs and don't speak up. And so, I can't, um, I would be remiss not to mention that. I think that's a really important piece. Um, Couple side notes. If you do take thyroid hormone, in most cases, you should be taking it first thing in the morning on an empty stomach, at least 45 minutes before eating or drinking anything other than water, and away from other medications or supplements. So there are a lot of things that interfere with thyroid hormone absorption, including especially um, iron supplements, calcium supplements, coffee, tea, soda, um, but other foods potentially as well, like really fiber-rich foods could kind of bind it up and make it really slow to absorb. So on an empty stomach is best for most people. Um, I think, did you have any last thoughts you wanted to share, Dr. Dowdy? I think we are um, happy to answer questions, but that is primarily what we have to share with you.
Mhm. No, just happy to answer any questions. Feel free to unmute yourself or type in the chat box.
And oh, let's see. Um,
Hi.
uh,
Hello.
okay, I got a direct message, but I will just respond in general terms. Have I ever worked with anyone with congenital adrenal hyperplasia? I cannot say that I have. I mean, I know a little bit about it, but I would not say I'm an expert on that topic by any means. How about you, Dr. Dowdy?
I would agree. Same. Yeah.
Yeah. Yeah. Okay. All right. So what we usually do with these classes is we send out a follow-up email. It'll probably end up being Monday or as soon as we can get your email addresses, but aiming for Monday. Um, and that email will just include the recording link, will include a discount code if you would like to come in and try, come in and see one of us. We have a lot of other services at Tummy Temple, which we didn't really touch on today, but if you're looking through our offerings and have something you'd really like to try, the discount code will be you have to schedule the appointment in the next week, but it can be for further out. You just have to book the appointment. And let's see, yes, we do virtual medicine, so absolutely. And then there will also be a discount code for our online store. And we've got a couple of our like nutrient products and thyroid focused supplements on there. So we'll share that as well. And so, if you're thinking like, oh, I really could use a thyroid support formula that has a little bit of tyrosine and selenium or that sort of thing, that will be in there so you can take a look and it'll be a 20% discount on that. Also, that will last a week. So you're welcome to use that if you like. And of course, you can respond to the email if you think of questions later. But thank you so much for being here.
Nancy, did you have a question? Your hand's up.
It just seems like it's so complex. How long does it take you to like untangle all the different possibilities?
Well, so what we do is we take a medical history and really kind of try and dig in for each individual person. And so we're like asking about, you know, gut symptoms and how is your stress and how is your sleep and all of these things. And through that, helping formulate a plan that's targeted to you. And then, of course, it's like sometimes it is step by step. And so,
It's
we do
probably
some
too
testing.
sure. I see.
Oh, uh, uh, we do some testing, we, start an initial plan, and then, sometimes we would do further testing later on. So like, for example, we like get an initial plan going and then like, oh, there's a
Let's
lot
go
of
find
bloating that's going on and on. maybe then we need to do testing for something like small intestine bacterial overgrowth and work on figuring the gut out. Or, maybe a future step would be doing a cleanse to like work on liver function. So it's true. It's not always one and done. People are complex and they have this whole life history before they reach this point. But sometimes it can go pretty simply and people can feel a lot better quickly. So that's the goal.
Thank you.
Of course.
Someone asked the question about lab work being covered by insurance. That really varies dependent on your carrier. Commonly, yes. And we have some solutions in the case that it doesn't. So we've got some access to some really great discounted lab programs where you can test all of these functional thyroid markers that we were just mentioning for, probably a couple $100 at the most out of pocket. So
I would
very
say, I think a lot less than that for
even
just
okay.
like a full thyroid panel. I don't know off the top of my head, but I think it's like a really good deal. Yeah.
Yeah, so this isn't like thousands of dollars in testing. This is maybe 150 if we were to order some of those specific autoimmune antibodies.
Yeah.
So yeah, really reasonable if you don't have insurance or your insurance has a high deductible before they will cover labs.
But a lot of insurance companies do cover labs, and then yes, this
Yeah.
all tends to be covered.
Yep, within Seattle also. Yeah, yeah. Between both of our clinics, we have 8 naturopathic physicians. We all treat thyroid conditions. Dr. Wood and I are down here in Lacey, but we can work with anyone in Washington State. Yeah. Yeah.
Do you guys dive deep into how some thyroid meds surprise TSH and using different meds like NDT?
Like desiccated thyroid synthetic versus the natural
Oh,
desiccated thyroid.
suppressed TSH.
Yeah.
Yes, yeah. I mean, we have a deep understanding of the different medications and how they work. And it actually can be problematic to suppress TSH too much. If you leave TSH, like if you give someone so much medication, even if they feel great, that their TSH is like really, really low, that can predispose them to osteoporosis in the long run. And so we don't want to do that. So we want to find a happy middle range. And we frequently use desiccated thyroid hormone. I would say I mostly use that. There's a small percentage of people that don't tolerate it. And so, we use the just T4 hormone or the synthetic hormones in those cases. But there are studies showing that by and large, most people feel better on desiccated thyroid hormone, which is like made from a glandular source. So it actually has some T4, some T3 in it. But the vast majority of conventional doctors only use the synthetic form called levothyroxine that's just T4. So and a lot of people don't feel great on that and they feel better on the other type. So yeah. All right. Any last questions? I don't think we missed
I
anything
I
here.
have a question,
Oh, sure.
and I don't know if you mentioned it because I was a little late, but I heard a long time ago that I don't remember if it's ibuprofen or Tylenol that it shouldn't be taken when you have thyroid problems.
I am not aware of that. Are you, Dr. Dowdy?
No, I mean, unless maybe someone had some liver issues and maybe Tylenol and liver clearance and liver conversion of T4 to T3, maybe that would be a mechanism.
Yeah. Yeah. Tylenol is hard on the liver. So, using
Not a
it once
great
in a while is
everyday.
correct.
Yeah.
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 So there could be something there, but it's not, I don't think it's like a well-known, like this pain med
Okay.
causes thyroid problems.
Yeah.
Yeah,
Okay. Thank you.
of course. All right. Well, we will send out that email aiming for Monday. So keep an eye out for that with those links. And thank you again so much for being here. We love teaching and thank you for all the questions.
Thank you so much, Dr. Wood and Dr. Dowdy. That's wonderful set of information. And I will, when I have a chance, upload the video to our YouTube channel and send out the link. And they can include that in the email so that if you we're like, wait, what was that one thing? Then you can go back and review it. So
Absolutely. Yeah.
thank you
Thank
so much.
Yeah. And thank you again, Monica, for hosting and for everything you do at the co-op.
Oh, thank you. All right, everybody have a lovely
Good night.
evening.
Yes.
Thank
Have
you,
a lovely
everyone.
day. Bye.
Thank you.